Just a little louder. Any CHWs in the house? Yeah. And what about our allies? Thank you all. Thank you. Welcome. Welcome to the Envision Sustainability Summit. And welcome to Spokane, Washington. I'm Renee Holderby-Fox. Folks call me LR, and I am one of the 3 Envision co-directors. I have this honor alongside of Lesley Wolf and Sherri Ohly. Yeah. And so we are just very excited to welcome you here. We're going to have an amazing few days together. And really, welcome to Spokane. I don't know how many folks have been here before. Ooh, that was quiet. I know this is one of the first opportunities that I've had to be here. I was here very briefly in February, but I want you to know that this is an amazing area to be in. Take it all in and enjoy it. I want you to know that this summit was really and truly a labor of love. Didn't come together overnight. And it was a lot of work and passion and dedication from the Envision staff and all of our partners. And like all great things, it started with just a thought. So I just want to share a story with you all. You know, shortly after one of the program consultants joined Envision, hey, Erin, she said to me, hey, LR, you can clap for her, it's all right. She said to me, hey, LR, wouldn't it be great if we could get all of the recipients together in one room? And I said to her, you know what, Erin, that would be fantastic, but I just don't think we can pull that off. And so I mentioned it to my co-directors, and also at the same time when there were other conversations happening, right? The COT was beginning, Community of Transformation was beginning to get up and running. And Essie said to Lesley, wouldn't it be great if we could bring all of the COT participants together? Also at the same time, you know, CHWs, right? We want folks in the same room with us. We want to be able to connect with folks one-on-one or in a group. And so some other conversations were going on, and each of the conversations were saying, wouldn't it be great to get all of the recipients in a room together? Well, you know what? Here you are. We pulled it off. I do want to share with you that the summit would not have been possible without some fantastic partners, and you'll hear about all of them later. But in particular, we want to acknowledge the CDC team. That's right. That's right. Because the reality of the situation is none of us would be here in this room together had CCR funding not come down, right? And the other piece of that is the CDC has worked hand in hand with us all along this journey, right? And I want to acknowledge the POs for all of the work that they've done, and particularly the POs and the leadership of CCR, because they all rolled up their sleeves when we talked about this summit and how we were going to pull it off. Everybody contributed. So I just wanted to acknowledge the CDC really quickly. This also would not have been possible without the amazing Envision team. Yeah. Oh, you all are really kind this morning. Thank you. You know, our team worked long hours on top of their regular duties, right? Nobody was hired to come plan a summit, right? We all had other duties, but our team really rolled up their sleeves. They got it done. And that would be challenging enough if we were all in the same place, all right? But we're not. In fact, Envision is made up of 5 different entities. all across the country. So we have our friends at the Wisconsin Department of Health. Oh, they're really kind, Lesley. We also have our friends at Match at the Pop Health Institute at the University of Wisconsin, Louisiana State University, Kinetic Health. Look, and then finally, the Center for Community Health Alignment. So we all work together. We all work together to make sure that Envision can really do the work that we do. And so I'm going to ask all of the Envision staff just to stand up for 1 second, please, so we can acknowledge them. And thank you all for the hard work and the dedication to make sure that this summit would be a success. And I just really quickly want to acknowledge that we also had some help from a couple of program planners. So thank you, program planners. And one of the values, that Envision really holds near and dear and is a piece to the sustainability puzzle is CHW leadership. And all of the 2110 partners, and in fact, let me just kind of back up a minute. You hear us say 2109, 2110s. The 2109s, as you all know, are the recipients. And the 2110s are Envision and the National Evaluation Partners. And so I just want to say that, we've had some wonderful, wonderful partners in them. And they also uphold the value and the necessity for CHW leadership. And because of this, we all have councils. We all have CHW councils. So WASEP, ASU, and Envision have strong CHW councils, and none of us could do this work without them. So if I could ask the Envision Council just to stand up for a moment, please, so we can thank you. ASU, any ASU council members in the room? And last but not least, WASEP. CHW council members in the room. It was important to do that because seriously, we would not be able to do the work that we do without the CHW leadership that we all get from our 3 councils. So now down to the real business. Each of you got a bag of goodies when you came in. And that bag has a book in it. Anybody find a book in their bag? I'm going to ask you to please hold on to that book. That's going to be your guide for the next 2.5 days. I'm going to tell you it's going to be your most valuable possession. Please bring it with you each morning when you come down. And in a few minutes, we'll hear a little bit more about some of the pieces that are in there. But know that this is a place for reflections each day, to keep up with the contacts that you want to make sure you follow up with, and to any other notes that you think are really important. We want to make sure you have a place to collect them. There's also some amazing tools in that booklet. And so, we know that all of your team members aren't here. And so I've got an ask of all of you. When you go back home, to share all of the information that you're going to get over the with team members who aren't here. I also want to remind folks that while you're here, take care of yourself, right? We have a couple uplift for you. We have an arts and crafts room if anybody's feeling creative. We also have a quiet room for prayer and meditation. Lactation room, right? So we're trying to make sure that everybody has the space that they need. And I want to tell you, best of all, there's some green space across the street, right? So make sure you can get out and get some fresh air too. And before I turn this over to my colleague, Lesley, I want to give you just a little bit of direction around the poster sessions. First of all, thank you all for developing your posters and bringing them and making sure they got here. And we are excited to see what you have to say. That's right. That's right. You all worked hard on those posters. So I want to say that the poster session 1, you can set up any time for that. However, all posters do need to come down immediately after the poster session so that we can turn that room over and use it for something else. Poster session 2, you can set up any time between the end of poster session 1 and the beginning of poster session 2, right? And again, those need to come right down afterwards. And poster session 3, same thing. Anytime between sessions 2 and 3, and they need to come down immediately. So I'm really sorry that we've got to take them down right away, but we need to utilize the space for other things. So, are you ready? Oh, man. Are you all ready? All right, that's better. That's better. Thank you. I'm going to turn this over to my colleague, Lesley, and we're going to get this show on the road. Thank you all for being here.
Right, is this on? It is. Wow, good morning, everyone. Good morning. I am Lesley Wolf. I use she, her as my pronouns. I am CHW ally, an organizer, and one of the Envision co-directors. It is absolutely a pleasure to be here with all of you. Oh my goodness. And yes, well, yes, y'all are beautiful. Okay, wait, let me figure out how I do this. Yes. So as Lisa Renee said, you know, it's about togetherness, right? We're here in person and we collectively, right? All of you. So it's my great honor really to acknowledge all of you, the recipients, the 2109s, CHWs and allies who have come together to do this work. And I want to give y'all just a moment of pause, right? Take a moment, look around, because this is beautiful. Look around at who is in this room and reflect for just a moment on all that you've accomplished and have a dreaming moment about all of what you're going to accomplish. We have big dreams together, big dreams. And we are here to really learn from each other, right? We are all experts in our own experience. And we get to learn from each other's experience, which is just such a gift. Yes. So you'll see everywhere, right? Everywhere, this logo. This is our summit quilt. And the quilt really symbolizes all of us united to sustain CHWs. And each piece really represents all of our unique contributions, our diverse voices, our backgrounds and experiences woven together. And in that, we create a strong and interconnected community quilt. And, you know, quilts are often, they often tell stories. And we have so many stories to tell. They tell stories through their patterns and designs. And in that way, it really symbolizes the shared history and values and aspirations of all of us working towards CHW sustainability. So we want all of you represented in this quilt. We're actually sewing a summit quilt, like for real. And so we want to invite each team to grab a piece of fabric. It's in the arts and crafts room, and create a piece of history, turn it back into us, and you will be sewn into that fabric. Yeah, that's right. All right, so now I get to dig into something that's in all of your workbooks, all of your, wait, I'm calling it the wrong thing though, I think. Is it called a workbook? What are we calling this thing? Guidebook and reflection journal. This thing has gone through iterations, y'all. So many names. But it's a guidebook and reflection journal. So in your guidebook and reflection journal is this image. Also, I know you all opened all your emails and watched all the videos that we sent you. And so you know all about this already, right? You did that. Of course you did. But just in case, I'm going to talk about it. So this is Envision's approach to capacity building. And this summit, we're saying, hey, it's about being in person, right? And the in-person part of this is really in service of, at its core, in service of relationships and relationship building. And that is really at the center of our work and best illustrated in this model. So at the very center, you see that triangle. It says growing CHW power. And power, simply put, is the ability to act or the ability to do stuff, the ability to make things happen. So growing CHW ability to make stuff happen, right? And in this case, we're talking about sustainability. So the key to sustainability is really strengthening that power, strengthening our power, our power to make it happen. And within that, so much of it rests on our capacity to influence decision makers, or even better, to be the decision makers. Yep, that's right. The ones that shape what is necessary, right? What is needed, and collectively shape narrative, right? The idea that all of our stories woven together hold meaning. And when our stories are out there and collectively told, they lift up, they hold that meaning, and that meaning making is central to our capacity. And with all of that, that's what determines resource allocation. So this approach to capacity building is really a cycle. And you could start anywhere. And it's really about starting with what you know. So since CHW work is deeply relational, and we collectively have insights into community concerns and priorities, you might start on the right of the triangle, that one that's over there, with an inventory of your current relationships and power. And we have space in the summit to practice just that, to be working on that. You might then engage in power analysis, where you use a tool like a power map, which is also something that we're introducing here in the summit, and is also, there's a nod to it in your book, and it lives on your virtual binder as well. And then within that, right, you're using that power map or a process of that to really think about just decision maker levers, and then directly impacting decision makers by developing relationships and aligning those interests. And through a combination of data, community stories, and one-to-one meetings, right? So those really relational meetings, where you're really listening for concerns and what people care about, you can then make connection, which is what this is all about, right? Make connection and find out where your interests and their interests align or connect. And that's the magic. That's the magic part. And so when we say that relationships and relationship building is central to this, it's really about that. It's about making those connections so you can build on it from there. And that is where you build champions, leaders, and coalition around the effort. And then we will also be digging into this in the summit. We'll have opportunity to practice what it looks like to really demonstrate that power by being in relationship with decision makers and holding decision makers accountable through follow-ups and reviewing decision making and continuing to foster relationships to know what's coming. All of that is just part of being in relationship, right? And that's the same. It's very reciprocal in our relationships. That's actually how that works when we're in partnerships. That we know the work, we get to know it deeply enough to be accountable to each other. And then you evaluate and reflect where things are at and how far things have moved, and analyze growth and analyze your capacity, right? Your power, and then continue to build relationships to grow that power. So it's a cycle we go over and over and over again. And it's hopefully a cycle that you all feel is pretty familiar because you've actually done it. This is our day-to-day. We may not always know that we're doing it, but we're doing this all the time. Okay. And then I want to zoom into that triangle, right? That idea of what it means to grow capacity, and name that, this is a breakdown of that a bit. That growing capacity, growing CHW power towards sustainability really starts at the base. That it's essential to emphasize that without CHWs and CHW leadership, sustainability is really compromised. That in some cases, decisions about the workforce have been made without involving CHWs, and we all know those stories, right? We've had those experiences. And that can really hinder sustainability efforts. It might move something along initially, but to truly call it sustainable requires CHW leadership, CHW buy-in, CHWs really informing and shaping it. So to address that issue, the American Public Health Association CHW section created a policy on CHW self-determination, which states that at half of any group making decisions about CHWs should be CHWs. That said, right? Yep. Celebrate that. That's right. Yeah. You're right, LR. Let's repeat it. So any decision being made about CHWs that group should be made up of at least half CHWs, right? Which is why when we were like, hey, let's hold a summit, there was a lot of intentionality around who should be at the summit, right? There was a lot of conversations about that. There was a lot of intentionality. And that was essential, that if we're going to be talking about sustainability, if we're going to be making sustainability plans, at least half of those at the summit need to be CHWs. And I gotta say, we very much accomplished this. So that is something to celebrate. Yes. So that said, both CHWs and CHW allies play crucial roles in this work. So it's not to say that all the work lands on CHWs. That's not what that policy means. That policy means that that partnership relationships are essential. So if you, as a base of that pyramid, right, if you've got that in place, that CHW self-determination policy, it really serves as the foundational building block to then be able to say, okay, we've got what we need to move through our partnerships and relationships. We can confidently now set agreements as to how decisions are made between groups, because we know that that decision-making process is shaped by majority CHWs. We then know that we can move forward with, very important decisions that are oftentimes made for, not by CHWs, related to, even the very definition of who is a CHW. And you then can confidently move forward with implementing those sustainability approaches. So relationships really build on trust, right? That relationship between CHWs and allies. And it takes so much courage to do the work in this way, to push against the status quo. So to do that, we need to be working in a brave space and really encourage all of us to step outside of our comfort zones, to foster learning, empathy, and meaningful change. And so we have some collective agreements to support us in doing this work together. We want to lift up and honor complexity, that there are multiple truths, that a truth is not the same thing as the truth. We want to hold up confidentiality, that what's said here stays here, what's learned here leaves here. Curiosity, that we are in this struggle together and we should be struggling. That's the work. Experimentation, that we want to lean into that discomfort. We should be uncomfortable. That's the work. And then finally, non-closure. We are doing a lot here, and we want to be brave enough to allow things to be unfinished and allow first drafts to come forward, knowing that the work doesn't stop here. It continues after the summit. Okay. So today is about sustainability foundations. And just like the model, we start with CHW leadership. That's right. So with that, it is my great pleasure to introduce Denise Octavia Smith. Denise is a woman of African descent, a community health worker, and a survivor of a rare chronic disease, and is the founding executive director of the National Association of Community Health Workers, known to many of us as NACHW. Yep. And NACHW is a central partner in this work. And Denise is a dear friend and a champion in our partnership. Please join me in welcoming Denise.
Hey, everyone. Good morning. Good morning. Good morning. There's a very small square that I am standing on right here. So I invite your prayers in this moment. I was like, oh, snap. I have like 24 inches in either direction. This should be interesting. I'm grateful to be here. I'm assuming that someone is bringing up the slides. And right now, Susan Mayfield Johnson is the most important person in the room because she's keeping time. So when you see me looking at Susan, you know exactly what I'm here to do. Okay, let me just make sure. Should I just keep advancing? Okay, I'll let y'all take care of it.
Caitlin, are you advancing slides? 43. Give Caitlin a huge hand. I want to acknowledge Caitlin Klosterman, the glue that keeps our team together, the chaos coordinator, the best ever, is going to find slide 43. No pressure.
Looks good to me. All right, let's get started. Hey, the National Association of Community Health Workers is celebrating, if you can just go back the prior slide, its 5-year anniversary. So it is with great honor as well as fear and trepidation that I stand here representing such an amazing organization. If I could have the founders of NACHW please stand. I want to If you just, yeah, please just remain standing for just a moment, just a moment. This really is more than formality, okay? You know, if you come from a church background, you know, you thank 8 million folks before you get started. This is really about more than formality. I want to acknowledge the founders in this moment for this summit, because what I want to say is it is almost prophetic that they would have worked together for so many years to create a national organization mere weeks, right, before they hired me as a CHW and the first executive director, mere weeks before a global pandemic that needed a national association of community health workers. And I want to acknowledge your path to help get us all to this place. I really just want to say thank you. Unbelievable, unbelievable. I don't know what you knew, but it was at the right time. And if you could remain standing, they got to get in their steps too. You know what I mean? Just rock side to side. We have a giant who has transitioned. A giant that were it not for her, we wouldn't have a national association. And I am here because of all of these people standing, but I'm also here because of her. And time never allows you to do the amount of justice that you should any great leader. But I just want you to look at this picture of Naomi Cottams, a woman of awesome faith, awesome vision, unbelievable perseverance, but also could roll up her sleeves and do the work with incredible grace, incredible skill to resolve conflict and move to the next step, incredible leadership to launch organizations in her home state in Arkansas and also at the national, and so many other things. No one can ever tell all of anyone's story. I just want to acknowledge Naomi. I know that she is counting on us, and we have an awesome job to do. And so it's with that I want to get into today's talk. Thank you so much, founders. All right, so you've heard me say it and I'll say it again. Community health workers are the workforce we need for the world that we want. And so here's what I want to say as we talk about relationship and prioritization and take action. This is what I want to say. There are a couple things that are essential to building a movement. And the first is to agree that there is a problem. Now, look, I have precious few minutes, so I'm making a lot of assumptions here. I'm asking you to call in a lot of your value right now. I'm asking you to pull up on why you're here and all of your purpose and all that it took for you to get here, because we have to move quickly in this morning. I believe that we agree that there is a problem. I believe in this room, there are the early adopters, the ones who said yes to the problem of COVID-19 in every community. You stood up in your organizations, you stood up in your community, you stood up for those who could not stand. And I want to honor that. If we agree that there is a problem, we then have to move to the realization, the confirmation, the consensus that we have the power to change the problem. And you have spent the last several years doing that work. And you're going to tell all of your stories in the poster sessions and the breakouts, right? So just acknowledging all the stories that you will bring into this space over the next couple of days. Well, we also have to agree on the ways that we're going to use our power to change the problem. And what I want to say to every person here is you have power. And what I'm going to ask you to do is set aside those things that create a barrier to your power and lean into the fact that in this room, there are those counting on you. There are those that believe in you. They believe in your leadership. They believe in your voice, your vision. You have power wherever you are, whoever you are, to make things better. So what I want you to do is I want you to go back and get that power right now, in this moment, while you're sitting in this chair. So if you were sitting here thinking, I don't know why they invited me, I don't know why I'm speaking, I don't know why. I know you all came on the plane, and many of you said that, shaking in your boots, fixing your slides, et cetera, et cetera. I want you to go back and get your power. Your power is not only about you, it's about every other person in your life, every other experience that allowed you to be in this moment and this time right now. Your power is not just about you. It is very much about us, because we need you and you need us. The Sankofa bird is a great example. You've seen it many times before. The bird is moving forward. We don't know where, we don't know how fast, we don't know stepping over what, stones, water, uphill, downhill, but the bird is moving forward. But the head and neck are turned behind. Because if we forget all that we learned and all the struggles during COVID-19, if we go back to business as usual, our communities will not go back to status quo. They will actually fare worse. There will be less trust. There will be broken relationships. All that you sowed into community, every partnership, every infrastructure will break down. And we cannot let that happen again. Do you agree? Oh, I came to do work this morning. No, I came to do work this morning. This is important. This is important. Lisa Renee called in. People are calling in. This is more than just about us, and it's more than just about our programs. This land, this soil has the stories of those who were greater than us, but never had a microphone. They healed bodies. They protected water. They built communities. They did things without pay, without recognition, without awards, without a salary, without respect, without legal protections, in chains, with whips on their back, ripped from their families, languishing in jails, ostracized because of their identities. We call in every single person, because that's how we make this land, this United States, this CHW thing, this movement, that's how we make it better, by remembering. It's why we have community health workers, because those communities who were here in these United States, where no system or policy or program or sector was designed or built for most of the folks who live or look like you, they stood up. They stood up with their faith. They stood up with their traditional practices. They protected their language and their beliefs. Oh, yes, they integrated. Oh, yes, they learned from other practices, but they upheld their values. And it's our values that are going to propel us into air. So I want you to bring each other in this moment. I want you to ask yourself the question, who did you bring into this room? Who's in this room with you? My grandmother is standing behind me. Before I came here, I sat with my mother for hours. She used to take me on those advocacy, wearing I've told you guys the story. My mother gave me a t-shirt when I was 12 years old with a cartoon penis on it. And it had a little cartoon condom on the top, like a head, like a hat. It was cocked to the side. And the t-shirt said, "Cover me, I'm going in." And my mom said, "I want you to wear this t-shirt everywhere. I want you to wear it on the bus. I want you to wear it in school." And my brother was mortified, completely mortified. But I was trained, you see, I was trained. I was raised to serve. I was raised to give. I was raised to see that I had power. Me, a Black woman who ended up being homeless. Me, someone whose doctor told me that I was going to have my kidney removed, that I was going to die. Someone told me that 12 years ago. Someone who told me the problem with your health and why these cysts are growing out of control is because you're a Black woman and you're having too many babies. I had my urologist tell me that. There's no reason why I should be here. If I had time to tell you my story, there's literally no reason. But I'm bringing every one of those people in. Not only every one of my supporters, but every one of my doubters too. How about you? How about you? Aren't you doing great things in your community? Aren't you overcoming obstacles right now in your community? Well, we're counting on you. You know why you came here. I hope that you will be changed by this awesome, awesome experience that the Envision team and all their partners brought in. So briefly, I probably have just a few minutes. How did COVID inform this movement? Do y'all remember 2020? Oh, snap, 2020. March of 2020, I remember sitting with the founding board, and we had, I think, maybe 300, 400 members at that time. And we put out a quick little survey, just asking people. It was March. You know, we didn't know what was going on. And we thought, well, we might as well ask, right? Why do we think we have all the answers? How about we ask? And we started hearing from our members, you know, I'm having difficulty getting a response from the folks who are supposed to be in charge of this COVID thing in my community. It's frustrating. Yeah, and they're sending surveys and questionnaires and all this, but they're not hearing me. That was literally a response we got from March 2020. And then talk about mentorship. Dr. Ashley Wennerstrom was kind enough to sit with me as I was probably babbling and trying to figure out what I was going to do in this moment. As a new executive director, what was I going to say? And we need to say something. And she helped me to write the very first article that I ever got published, right, in Health Affairs. And it was about this: to strengthen the public health response to COVID, we need community health workers. Because what we realized was folks didn't know who we were, what we could lend to this global pandemic, how we do the work. They were actually laying many of us off, if you remember. Then June 23rd, 2020, I will never forget this in my entire life. Because by this time, we had the founding board and we had 2 staff members at NACHW, just 2, myself and Bernadine. And I turned on CNN, and this brother up here was on CNN. And he says, I'll never forget this. He says, well, we are taking $40 million. I'm paraphrasing here because I don't have time to show the whole video. We're taking this $40 million and we're giving it to the Morehouse School of Medicine, and they're going to partner with, and he started rattling off these big, well-known organizations, Unidos US and all these. And then he says, and the National Association of Community Health Workers. And I thought, wait a minute, that's me. I was like, I should call Bernadine and we should get out of our slippers and figure out what we're going to do in this moment. Listen, talk about being called. Do you remember when you were called to this thing? Do you remember how much we didn't know? Do you remember when we were afraid to order food? Do you remember when you would bring the containers home and you were throw them away? Do you remember what it was like? Your children home, stores closed, people afraid, just afraid for their elders, just afraid. NACHW, we were a part of this journey with you. We learned with you. A couple things I just want to share, and then I'm going to start to close. A few things that the way that COVID informed us. Number one, community health workers, their self-care and their mental health was really impacted. Another giant in the room, Dr. Susan Mayfield Johnson. I think you should give people their titles and their flowers. You know what? The founding board already had national ambassadors all across the country. There were 20 ambassadors in 19 states. And Susan said, well, let's get them together. And for her, research was easy. I don't know. She was like, we're going to do this, and then we're going to ask them these questions, and we're going to analyze it. And I was like, I'll just call the meeting. How about I just call the meeting and show up? We started writing about the fact that CHW's self-care was just plummeting. If they had a self-care routine, it was tight. A lot of organizations started creating online self-care support groups and trainings for community health workers. I had a chance to write an article in USA Today about a woman, one of my mentors in Connecticut, who started an organization after she had been a refugee for 10 years and came to the United States, was being re-traumatized by the isolation and the suicides that were happening in her community. Great, great leader. It also galvanized our leadership and our innovation. We did a lot of other things than just hand out masks. Please make no mistake. Community health workers were reporting AAPI hate. We were addressing mistrust and misinformation. We were launching organizations. There are some networks and associations that were launched during COVID-19. And yes, we did partner with the CDC as well. They reached out to us and we reached back with what we knew. Global investment. And you all, if you've heard me speak or if you've been observing, you know that with the incoming Biden-Harris administration, community health workers were prominent in the Health Equity Task Force, the Pandemic Preparedness Plan and the Response Plan from 2021 and 2023, the Mental Health Strategy. All over the globe now, we're being lauded for our roles to build trust and relationship, to innovate, to build strategy, to tailor, et cetera, et cetera, et cetera. Well, it also exposed these barriers, these structural barriers that have been historic. They are no accident. They were designed to keep power in its place. And many organizations started saying, hold on a minute. Why am I competing against these large organizations for funding? Why is it that I have to turn in my timesheets in English and not Spanish to get paid for the job that I did? These are real stories that we heard. As quickly as the funding came, it began to leave our communities. Since 2022, community health workers have been losing their jobs. Not just today, since 2022. It also revealed some other things, like CHW's experiences with hunger. No, not the communities they serve, CHW's. 23% answered in the affirmative to 3 of the 6 USDA questions, saying that they have low food security. Almost 10% say that they have very low food security. I wonder why that is. I wonder if it has anything to do with the fact that we're the lowest paid of public health professionals, that we don't have jobs with health benefits, that our grants come and go, as our titles come and go, as our positions come and go, as our employment comes and goes. Then as the public health unwinding became to be a reality in May of 2023, we asked again, and we heard from community health workers again. My community is still trying to respond to COVID and we don't have the money. My employer doesn't have enough money to keep me or another CHW I know. Yeah, the question is, what are we going to do about it? And I see the timekeeper, saying, oh, you got to wrap it up. All right, so let me just wrap it up. Do you mind if I'm going to move through the slides because I don't think all these are important. It really isn't important. It's not about the slides at all. It's about what we are deciding to do in this moment. Change does not roll in on the wheels of inevitability. It's not just going to happen. No, it is not. And even if it's in your strategic plan, even if it's on your website, it's not just going to happen. Continuous struggle is necessary. And so I invite you to straighten your back, to take your vitamins, to get some good sleep, to be prayed up, and to get back into the struggle, because our communities are waiting for us. Oh, yes, they are. They're waiting for us. There are great leaders that I look at, and I think I'll just close here, and I hope that you all have great leaders that you look at. I think about, for instance, what our children went through and how they had to adapt every single area of their life. And many of them did it with so much grace. They struggled so much to be isolated at home, to try to learn online without their friendships, without their relationships, their identity being crushed through social media. How much they went through. My daughter was so strong during that time. I think about the fights that were fought by MLK in prison. I think about him visioning while he was in the jail cell, not speaking behind a podium, but in jail, still thinking future, still thinking victory. I think about Gandhi laying down his law degree and his suit in South Africa and taking up the making of his own cloth and going to the sea and making salt. And in this quiet way, moving a revolution by the change in his own life. I think about the fight we have right now for women's rights. I think about what women are going through right now, the horrible decisions they're having to make because people who are not them are trying to control their bodies, their lives, and their health care. I think about the water protectors, the people you never see on TV, the mostly women who are standing in the gap for water. Human beings cannot exist without water. And we don't have a national, international movement to protect water. This is about our values. This is about what we know impacts health. And I'll close with this. Up to 80% of what impacts a person's health does not happen in a doctor's office, does not require a prescription drug or medical treatment. That's not Denise, that's science. If we do not move upstream, if we do not take this movement to the community and give community members what they need, we'll be back here talking about what we tried to do. We'll be talking about a 3-year program that started and stopped. Let's build a movement for health, for well-being. Let's share power and knowledge and information. Let's come together. Let's come together. I love each and every one of you. I believe in each and every one of you. And I want to thank you so much for your support of each other and for community health workers worldwide. God bless you.
Gratitude. Gratitude. Great gratitude for you, Sister Denise, and for your presence in our gathering and for the energy you bring. And also gratitude for all of you. We open with that space of a grateful heart. That's what this whole morning is about getting us aligned, getting our hearts beating as one, and acknowledging the expertise that each of you bring. So thank you. Thank you so much. I wanted to make sure that everybody has a spot at the table, right? Is that our thing? Everybody has a spot at the table. I know we have people standing in the back and we have folks sitting along the sides. If you have a spot next to you open at the table, can you raise your hand? Folks who don't have a spot at the table, it is both a figurative thing and a literal thing. Come grab your spots at the table, please. We want to be the good hosts that we know that we are, and everyone at the table is looking to meet you. You're the people we've been waiting for. Come find your spot. And throughout these 3 days together, keep finding your spots. Keep mixing it up. So these folks that are finding their way to the table, you know, they're coming into a brave space of, hey, I don't know if I know any people. Hey, Catherine, come on in. CHW Council member, Catherine Haywood, let's give her a hand. And you're lucky if you get Catherine at your table. Thanks, Monique, finding a spot. Yep, everybody come on in. I also want to give a shout out to the 50-some people that are on Zoom this morning. So in addition to all the people in the room, yep, everybody say hello. Glad you are following along at home. If you didn't know, we are streaming this. The plenaries are being streamed. You did get an email that I'm sure you read about that already. Share it with your teams. Anyone within the 2109, 2110 community, send this out to them so that they can follow along. Oh, Catherine, everybody like me, I want Catherine. Catherine's going to shoot me after this. That's okay. I'm up for the challenge. So grateful for all of you. It's also my job to extend some more gratitude to the rest of our folks that we are in partnership with. So our national CHW partners, that's right. Denise at NACHW, and also wanting to recognize our friends at the National Council for Community Health Worker Core Consensus Standards. Hey, C3, raise your hand. Hey, they're back there in the corner. I see some of them. They're all over here. They're presenting as well during the conference or during our summit. And this is their new name. So start looking for it. The National Council on Community Health Worker Core Consensus Standards. And many of you built the C3 standards, many of you in the room. And many of you now benefit from those. We're pleased to have them as partners with us at the summit. Also, Sherri, raise your hand, y'all. I see some over there. Yep, I see some right here in the middle. That the Community Health Worker Common Indicator Project, now known as the Community Health Worker Center for Research and Evaluation. We've been working hard together as a partnership to build the narrative along with our national ally partners. In your resource book, you'll find in the back that there are a compilation of resources that each of these partners, as well as others, have brought together to benefit our work here at the summit. These resources are both in the back of your participant guide and reflection journal, and they're also online. You all received a QR code in your bags that will take you to all the resources where they're linked so that you can have that with and without your journal, and that you can also share that, and that also is on our website. So shout out to all these folks. Raise your hand, Partners in Health, the Mid-American Regional Council. Yeah, there they are. Our friends at ASTO, NACHW, NMPHI, and the APHA CHW section. Yes. So movement building is about aligning the narrative. And that's the work that we're doing in our resource sharing and in the messaging that we have going out. So grateful for each of them. And our CDC partner family. We've mentioned that already, that this wouldn't be happening if this funding hadn't existed, the first named CHW funding coming out of the CDC. And our 2110 partners at ASU, I see some of them right up here in the front. Yeah, say hello, our evaluation partners. And as well, a whole nother slide of evaluation partners, we are everywhere. And many of you know these folks from the TA that they've already provided to you. And our WASEP partners, WASEP being Washington State Department of Health, JSI, CHW-CRE. Let's hear it for evaluation. That's right. Everybody needs some love, and especially our evaluators. And here's just a little bit of data for you. We talked earlier about the APHA self-determination policy. Do you think we've met it? Absolutely, without a doubt. We are more than half. We are 55% community health workers in this room. So we met our goal, and we only know that from the great data collection that we have going on. Take a deep breath in. I've been saying that this gathering, this summit, is kind of like a wedding. My daughter got married 3 weeks ago. Yeah, yes, big, momentous occasion. And it went by so fast, you know, and that's how it is with things that are meaningful, things that have your energy and you build for so long. The buildup is so great, and then it comes, and then it's gone. And I want you all to really be aware of the moment that we are in history right now. To really soak it in, to meet all the people. So as people are joining in, oh, we got some more people looking for spots at the table. Raise your hand. If you got a spot open, here's your spot. For people who are just coming in, find a place at the table. That this is a moment in history where we're building the movement. And really bring your full attention and presence. Take the opportunity to meet the people that you don't know from across the country and across the world. Our Island Nation friends are here as well. Yeah. Let's hear it for the Island Nations. Yes. They traveled far. I guess the buzzword for today is, how was your flight? What's the answer? Long and worth it. I hope it was worth it. So before I introduce our next federal speakers, I want to do a fun thing. because I like fun. I always say, if it's not fun, why would we do it? I need everybody to get in this picture. Let me see. Put your hands up, big smiles, and I try not to fall off this precarious couch. And everybody say, CHWs. I'm getting y'all in the room. Yes. You're in your moment of history. Take it. Make it worth what it's worth. And now it's my great honor to bring up our next two speakers. I'm going to introduce both Dr. Karen Hacker and Georgia Simpson. Dr. Hacker is the director of the CDC National Center for Chronic Disease and Prevention and Health Promotion. So big thanks. Everybody say thank you. The center that brought the money to this work. We appreciate what that took. It sounds like a thank you, but it really is thank you that the center took the lead. The center has taken the lead for many years with CHW strategies in the chronic disease section, and we appreciate that. We appreciate you being here. Dr. Hacker oversees a portfolio that includes maternal mortality, school health, obesity prevention, smoking policies, and chronic diseases. Dr. Hacker has a long history of public health practice and has held a variety of leadership roles in public health, hospital administrations, and academics. Dr. Hacker received her MD from Boston University School of Medicine and her MPH from Boston University School of Public Health. She is currently an adjunct professor at the Emory University School of Medicine and leading this initiative. I'd also like to introduce Georgia M. Simpson. Nice parade wave. Also a longtime ally to the work, working at the Office of Minority Health and in the region and nationally to champion the work of community health workers. Georgia Simpson is a public health practitioner with 30 years experience in advancing efforts to address racial and ethnic health inequalities and upstream social, structural, and environmental determinants that influence health and well-being. Ms. Simpson has worked at the local, state, and federal level, applying her skills in design and management of complex programs to meet population health needs. As the Regional Minority Health Analyst, Assistant Secretary of Health, you may remember the OASH Sustainability webinars that took place last year. Shout out for those. Those are in your resources online and in your handout. Now, what was I saying about OASH? In Region 1, New England, she promotes minority health priorities and coordinates efforts across the 6 New England states to advance equity goals. I'd like to welcome both of our speakers and invite Karen Hacker to the stage.
Thank you. I think this works. So first of all, I want to just say that I really, really do not like following Denise. The last time we spoke on a panel, I went first. So because she is just amazing and it is a hard act to follow. But with that, I'm going to talk a little bit about why we even did this at CDC and sort of how it came to be and a little bit about where we are now. So first of all, I want to just say that I am not new to the community health workers. I spent pretty much my entire career in the community, and I will probably do a shout out to Darrell and Lisa because they taught me pretty much everything I ever learned about community health workers. And I was probably involved with community health workers before they had a name. Women that I worked with in the Boston Public Health Commission years ago who knew everybody in the community, and particularly a woman named Louise comes to mind. You probably remember her, Darrell, who just seemed to know every teenager in Boston communities who are at risk for teen pregnancy or who are having babies. And that kind of connectedness, those relationships, that understanding of what was going on was absolutely the key to being able to solve some of those challenges. So I got to CDC about 4.5 years ago. And I think one of the reasons I came to CDC at this point in my career was I thought, I've seen it on the other side. I've written these grants. I used to look at CDC and think that all they really were grant makers. And I will tell you, when I go out to meetings, pretty much that's what everyone thinks we do. And I would go to like the APHA and I would go up to the CDC booth and I would ask like, oh, well, what's the next grant you're going to put out? And, do you think I could apply for it and everything? And then I get to CDC and I understand that the people in those booths had no power whatsoever. There was no way that they were going to help me get that grant. But that said, I thought maybe coming into a federal position, I'd have some ability to shape the future of the field. And that was really what drove me to come to CDC. So this community health, going backwards for a second, make sure where I am. Great. So this community health workers for COVID response and resilient communities was an example of an opportunity that presented itself to us. And unfortunately, it came because of COVID. Because of COVID and because of the additional new resources, we had an opportunity in the Chronic Disease Center to forge a path with community health workers. And suddenly, $300 million got dropped in our laps. And we were asked, you should do some stuff on community health workers. What do you want to do? And with the knowledge that we had, the partners that we had, like NACHW, we started to pull this together. We didn't have a lot of time, and the communities were in desperate need for individuals who could really get out there and make the connections that were so critical, particularly with regard to getting people the education that they needed, dealing with challenges of communication, with getting them into the healthcare system when everybody was afraid to go to the healthcare system. And so in August of 2021, we launched what's now called CCR. But as I said, it was $352 million. We ended up funding 67 states, localities, territories, and tribes. And I'm going to just say, because some of you probably remember this, there wasn't a lot of happiness with the fact that we only funded states and territories and tribes, because we couldn't fund community organizations that had been doing this work for so long. And that's because of the dollars that we got coming with language associated from Congress saying, this is the only place that you can fund. So it was contingent on the recipients of dollars to turn around and make connections with community groups that had been doing this work for a while. And I'd say there was some success there, but I am sure that there are many stories about how it didn't support as needed some of the agencies and organizations that needed those resources. We also funded, as you heard, some of our colleagues at the table to do some technical assistance. And one of the things we were really trying to do was more rapid evaluation, that we could know what was happening in the field, because we were getting asked all the time, how many did you hire? How many did you, what are they doing in the field? How many people did they connect to resources? All those questions. But you guys did an amazing amount of work. And while the final evaluations are still not done, I think there's something coming out in the near future. This just gives you a sense of some of the accomplishments. So first of all, these dollars hired over 1,000 community health workers. And while there are a lot of folks at CDC, and some of them are here today from various divisions who've been working with community health workers for a long time, they hadn't given dollars to actually hire people. This was a first. We trained over 2,000 community health workers together, specifically to support COVID-19 response efforts, but a whole variety of other areas as well. 5,900 vaccination events. 787,000 referrals to healthcare and social services, and over 16.9 million individuals who got education and messaging because of the work that you have done. So give yourself a round of applause. Now, at CDC, we have been really focused on health equity and social determinants of health. And we've defined it as such, which I'm sure you're aware of, that health equity is when everyone has a fair and just opportunity to be as healthy as possible. and that the social determinants of health are those non-medical factors that are the 80% of what ultimately determines your health. And we have been working in these areas, certainly since I've been at CDC, trying to push things upstream. And I think community health workers are truly the foundation of this work. But there's a lot going on right now. And it's good news and bad news. And you're going to hear me talk about the opportunities and the challenges as we think about sustainability. So today, the healthcare system is getting very involved in this area, as you probably are aware. And they are redefining some of the things that we consider to be social determinants we're calling social needs. Social needs tend to be at an individual level. Somebody needs food, somebody needs housing. And the social determinants tend to be at the population level, the policies, the practices, the environment that surrounds us. So in our work with community health workers become a bridge between those social needs and the social determinants. They are critical to making that a reality. And in our CDC work, we have supported community health workers through our various grants in program implementation and resource sharing and evaluation. I think this meeting is a culmination of so much of that work. The time, however, is come when both opportunity knocks, but major challenges exist. And Denise alluded to this earlier. Bottom line is the healthcare system has gotten into the act in a way that we did not expect, honestly. For the first time, the Centers for Medicare and Medicaid are now starting to reimburse in many ways, both through Medicaid, but newly through Medicare for community health worker services. For those of you who've been involved in this field, this is kind of miraculous, right? I mean, I don't think many of us believe that it would ever happen, but oh my goodness, does it present challenges. New actors are getting into the act, people we never heard of ever before, who are now saying, oh, we do community health workers. We can help you out. You just have to pay us hundreds of thousands of dollars and we'll make all this a reality. And if you're a small organization that doesn't have the infrastructure and can't necessarily make the connections with a federal organization or with various healthcare systems, suddenly it's like unbelievably challenging. And so we really, I think, have to band together. Now, on the Medicaid side, let's face it, most of this is happening at state level. And it is totally different across every state, right? There are states that has certification programs. I just talked to, I think it was Ohio. Anybody from Ohio? I think Ohio is doing their certification through their nursing board, which was like, wow, where did that come from? But if it's working. But there are other states that aren't doing certification. And then there are others that are requiring licensing. It is like the Wild West, honestly. And if the community health workers are not at the table to help figure this problem out, believe me, it will be done to us. It will be. I am telling you, when there is money in the healthcare system, everybody's got their hand out. So when I say the time is now, I'm not just saying this from you got plenty of whatever. No, I'm talking about now, within the next couple of years. The new Medicare rules, I don't know if you've looked at these yet or you know about them, but in order to get reimbursement for community health workers through Medicare, you have to ally yourself with a Medicare provider. They have to bill for you. And then hopefully they're going to give you the money if they receive it. But we have yet to see a lot of examples of this working effectively. And I love CMS. A lot of my friends work there, but the bottom line is they're an insurer. They make a rule and then they get out of the way and they let the world sort of figure it out. And that's where we are now. So there is such opportunity right now here in this conference to put your voice into the mix, think about strategies, to figure out what has to happen at a national level versus what's going to happen at a state by state level. And I really urge you to be thinking about this, because this is really about survival. If we're going to have these programming, I mean, I suppose if you're lucky enough to have a sugar mama or papa who's giving you a lot of money, right? And who's telling you that they're going to be able to support your community health worker program ad infinitum, bless you. But I don't think that that is the case in most scenarios. And I worry that when these new resources become available, that those who were providing funding previously will suddenly say, oh, we don't have to provide that funding because guess what? They can get reimbursement. I brought together, with the help of others, a number of federal agencies to talk some of these things through. And these were some of the areas that came up in that discussion. Obviously, the sustainability issues, the issues of integrating strategies. There are a different name for community health workers across every federal agency, and nobody's interested in coming together to have one they have like sort of one definition, but all kinds of different names. We're also seeing spin-offs. So for example, cancer navigators. Not sure if you consider those community health workers or not. Are those going to get wrapped up in cancer care and maybe get their reimbursement that way? Promotoros, are those going to get wrapped up, for example, in obstetrical care? Lots of this going on right now in that area. So we've really got to start thinking about, if not already, and I know some of this is already happening, this isn't new, but just to remind you all, we got the reimbursement and financing approaches that we've got to be thinking about. We've got to build the capacity so that people can obtain this reimbursement. That means infrastructure, and nobody pays for infrastructure, which is always a challenge. And one thing I will just say in closing, because I can only imagine that many of you think I have deep pockets and I just can come up with a new strategy for funding. And the reality is right now that our CCR funding is hitting a cliff. It did not, there's no line in the budget. We keep asking, we keep advocating. There have been a few bills that have sort of percolated to do that, but it hasn't happened. As you also probably know, we're not in the best fiscal climate right now at the federal level. So we'll be lucky if we have level funding and not increases like we have seen in prior years. But that doesn't mean that we cannot be in front of this curve. And I think the work you are doing and what's happening at the state levels and how we can work as a team to keep moving this forward, we've got the momentum. We really need to work together to get the sustainability a reality. And we need to hear from all of you about what the challenges are in each of these states so that we can address them. We're committed to focusing on the sustainability issue and figuring out how to support all of you in this next phase. I'm going to end my comments there. I think I'm right on time, but I do want to say, first of all, amazing to see everyone. Thank you for everything you have done and still will do. I am truly an ally. I want to see continued success in this arena, and I'll keep fighting the good fight. Thank you.
Thank you. Thank you.
Okay. So, thank you. I just got the baton passed to me. Oh, I don't have slides. Oh, look at that. But I really don't have slides. You know, this has been an incredible day already. What I want to say is I was on the elevator this morning and it comes down one floor and the doors open up and who do I see but Honey Yang Estrada. Exactly. I need say nothing else other than the joy she brings, not just to her work, but clearly to others. Thank you for the embrace this morning on that elevator. And then what happens? I'm doing my little name tag thing and putting my little stickers on it. And I was about to pick it up and like something stuck to it. I peel it apart. And it's Denise Octavia Smith's tag. I'm like, okay, this is just good energy and karma. And so I appreciate the universe doing those two things for me very early this morning. I just want to thank all of you. And if you haven't heard it enough, you're going to hear it again. You are incredible. Don't ever think otherwise, how challenging things may get. Incredible. You are very welcome. Thank you. No, thank you. You know, I just want to say also a thank you, Lisa Renee Holderby-Fox. Sherri Ohly, thank you for giving me space and time on the agenda to share. There are so many names I can call out. You all know many of them. Darrell, go way back, way back. Thank you for all that you've done. Know that I'm only here today able to talk because I follow in the steps of these people who have laid such a great pathway for us to come behind and to continue to learn. So what I want to say, hopefully, is very simple, and to reiterate the strong support for CHWs. Amplifying the CHW workforce is in large part due to the fact that there is tremendous support at the leadership level. So where I work, in the Office of the Regional Health Operations, which is within OASH, I know a lot of acronyms, my apology, and the Office of Minority Health. Rear Admiral Felicia Collins, who is the Deputy Assistant Secretary for Minority Health and Director for the Office of Minority Health, identified CHWs as a priority for the office and has been a strong supporter of CHWs and for sustaining the workforce and the vital role it is playing in addressing the social determinants of health. David Johnson, the Deputy Assistant Secretary for Health, Office of Regional Health Operations, my shop, has committed to and prioritized CHW sustainability through targeted regional efforts. And if I know you're not familiar with ORHO, but that is the home to the 10 regional offices across the country. So this work has been instilled, embedded in the work that we're doing in each of the regional offices. And then I have to absolutely just give a quick shout out to my regional health administrator, Betsy Rosenfeld. Betsy has been in this fight for a long time, and I see some head noddings. She's been there along the way, all along the way, and she provided support and offered guidance to, at the time, a newly forming New England CHW coalition, Region 1, as it came into being. And I just want to say that May will mark the 12th anniversary. So we know sustainability is about helping to coordinate opportunities to establish more permanent financing mechanisms that will transition CHWs from what you've heard, mostly episodic short-term grant funding that provides at times temporary employment, maybe 3 to 5 years, depending upon the grant. We know that this has major effects on the community health worker workforce. Job insecurity is disruptive, to say the least, and can be destabilizing. When will the next grant come? What will I be asked to do next? Who am I prioritizing? And what does this mean for me and my family and my community? We get it. I just want you to know we get that. In addition to financing, sustainability also relates to organization infrastructure. I believe somebody had that on their slide. Are our organizations established, have the building blocks to make certain that community health workers and lived experience workforces can succeed at what it is they do and do unlike anyone else can? Are they well integrated into teams? We hear a lot about teams at the social service or clinical level. Are they well integrated? Do team members even understand what CHWs do? Do they understand the expertise and value? And so with that, one of the things we did through the regional operations aspect was we had the CHW Sustainability webinar series. And it was a 4-part series, and we recognized, myself and 4 of my colleagues in Region 2, 4, 6, and 7. So that's Marlene Vignier. Region 2, if you're here, Marlene's your girl. Region 4, that's Dr. Rashonda Ivory. Region 6, Ella Ewart Pierce. And Region 7, yay, Region 7, Corstella Johnson. And why we did that was because we were hearing from CHWs and also from those who weren't CHWs that they didn't understand, they didn't know enough. What could we do to facilitate this understanding and knowledge building and awareness building? And so through this series, where we also kicked off with Denise Smith, thank you for laying the foundation, the history, the importance, what it is you need to know before we even go further. Bringing in Sankofa, looking back, understanding where we were coming from in order to go forward and be objective, not just objective, but be realistic and identify opportunities. The series just laid out some steps, everything from organizational infrastructure, and then actually what's happening. We had Tim McNeil share with our group on reimbursement for CHWs so that we can get to a place of sustainability. In addition, OMH and ORHO were very supportive in identifying staff to help lead a much broader opportunity, looking at the national landscape. And when I say, this is where I just have to lay it down. Captain David Wong, if you're listening, if you're with us today, an amazing visionary. I had the opportunity to work with Captain Wong, he just recently transitioned his role out of OMH. He was a chief medical officer and a pediatrician by training, and took on his role as lead for the CHW work in OMH with such vitality, vigor, but also clarity of purpose. And I truly do mean being led by purpose. Setting out and understanding what is happening, not just now, but what opportunities can we create? What are we not thinking about? Who else do we need to talk to? So I'm sure many of you in this room have had a conversation with Dr. Wong, the master networker, the master introducer, so that we can all work together. He had a saying on one of his charts that collaboration is multiplication. And I really believe that it's through our shared connectedness that we will multiply our efforts and get to true CHW sustainability. One of the things we had was a sustainability working group called the HHS CHW Interagency Working Group. We have monthly meetings for the agencies within HHS, OASH, and HHS. So I'm going to throw out acronyms. I am so sorry. ACL, and CMS, who you will hear more about later on today, HRSA, Indian Health Service, NIH, that's National Institutes of Health, OMH, and SAMHSA. Can't give enough credit to those folks coming together and wanting to understand how together we can leverage our federal opportunities and just strength. Peer support. CHW national leaders came together to talk about breaking down silos. Where do we have a shared opportunity in our unique roles? And how do we move things forward? Mobility managers that I had never heard about before through the Federal Transit Authority, speaking with us, again, breaking down silos, because guess what? The movement can grow and become bigger. One of the things that happened was the creating of a standalone CHW profile for the first time ever in the Bureau of Labor Statistics Occupational Outlook Handbook. It was combined with health education specialists and had very little real estate. So this handbook is a handbook that many young people go to when they're starting to dream about the things that it could be in the future. It also helped employers understand more about the workforce. What happened through that process was not only the standalone profile, that is community health diverse, but it clarifies, amplifies, and elevates the workforce. It is language that's derived from the C3 project and has core competencies identified. And it was the opportunity for the first time to call out within it promotores, community health representatives, and peer support specialists. Thank you. So we are very much aware of the near-term implications of funding expiration. You've already heard from Karen Hacker about what's on the horizon. But thinking about what's on the horizon also may allow us to think about opportunities. And many of these opportunities, I will say, are going to happen very locally. I'm going to call out one coalition right now, and it's anyone here from Pennsylvania? Ha ha! I'm going to meet you later. So the Penn CHW Collaborative, oh my gosh. I met the group of folks that formed that collaborative. The energy is infectious. And so are many other of the collaboratives. But I'm calling them out because we're thinking about how do we move beyond the CHW fiscal cliff? What is before us? There is a near-term urgency around ensuring that CHWs that are skilled, trained through many of the programs and opportunities, where's the employment opportunities? And how can we bridge this potential gap? And that work is going to happen locally. It's going to happen with people who know other people. It's going to happen among the CHW coalitions, associations, offices of CHWs, and others that can say, hey, there's a sector looking for people who are like CHWs. They may not call them, we know there are many titles, but that is where we can begin to break down, continue the silos, see what the opportunities are there training needs? Office, ORHO, my role is one to help coordinate. So that is the role that we will play as facilitator, coordinating conversations. You tell us what resources are needed to be brought to that table, to that conversation, and we will work with you, stand hopefully alongside you always to make that happen. I'm going to shorten it a bit because I have 0 time and I'm going into negative time, if that's even a thing. But quickly, some of the things that we're learning, we have the CMS Medicare physician fee schedule as an opportunity, more to be discussed on that later. I'm not the expert, so I won't even go there. But we realize that in that opportunity, we may be looking at things like the agencies, the local agencies, area agencies on aging. It's called AAAs, and so that gets stuck in my head, but it's the local areas on aging. Opportunity, their possibility. There's CCBHCs. I don't know if you've heard what those are. Those are certified community behavioral health centers, and those come through SAMHSA, as well as other opportunities for maybe bringing in CHWs as supplemental or in connection with the behavioral health workforce in those types of clinics. Much more thinking on that going on, but there are opportunities that we are exploring around the CHW cliff. So although identified by various names and titles, this workforce, CHW workforce, you all have a long history, and we know this, of effective community, public health, and healthcare engagement. You've been the instrument in providing expertise in community norms and values, in identifying barriers to people's life opportunities. CHWs speak the language of the communities they serve. They walk in the shoes of so many who they support, and they are the trained and highly skilled professionals, okay? Professionals. You go, don't get me started. Thank you. Professionals. CHWs, and I'm not telling you what you don't already know, but let's put it on the record. You understand the impact of social determinants of health on people's lives and the people who you walk beside tirelessly. I recall a senior public health official once saying to me, to an audience, she's like, you know, she was a physician and she was seeing a patient, and the patient had their CHW with them, and the patient said to the doctor, you know, Doc, I really like you. You're really good. And I really do like you. But she, pointing to the CHW, she gets me. Exactly. She gets me. Another thing I want to say is that, and it's in the words of the late and to me great Dr. Paul Farmer, in his documentary, Bending the Arc, he talks about public health a lot and public health in other countries. And there was a line that I kept putting on repeat because he said, community health workers are very special people. And to us, to me, I thank you. I thank you for what you do on behalf of public health. I thank you for allowing me to walk alongside you to learn from you each and every day. And I hope you have a great rest of your summit. Thank you.
Thank you. It's because of federal support, state support, local support that we are where we are. And we really appreciate opening this session with all the support of our federal partners in the CDC and the Office of Minority Health. All right, y'all, let me walk you through what's going to happen next. There are 4 amazing things happening between now and the end of your day.